So I'm not going to ask who's experienced ageism, because you'd be outing yourself as in the category that would experience ageism. Or we got one hand. But what I will say is, obviously, all of us are aging, and if you haven't experienced it at some point, you're probably going to experience it. And talking about it now, I think, is really important. We're seeing it in workforces, we're seeing it in our society. So I'm really excited about this next speaker to kind of bring us up to speed on this issue. So we have Kris Geerken here to join us virtually and speak on changing the narrative on ending ageism. Kris Geerken is the co-director for Changing the Narrative. She developed Changing the Narrative's age-friendly healthcare program and intergenerational conversations toolkit. She's also an instructor at Metropolitan State University of Denver's Health Professions program. Changing the Narrative is the leading effort in the U.S. to change the way people think, talk, and act about aging and ageism through evidence-based strategies and innovative public campaigns. Please welcome Kris.
Hi, everyone. Let me know if the sound's not working. I've got my chat on, but hopefully you all can hear me, and it's great to be here with you all virtually. Thank goodness for technology. But thanks for including ageism as one of the topics in today's event, because this is a really important topic in our work, and I just think it's something that all of us need to understand better. So as mentioned, Changing the Narrative is an initiative that we're actually an initiative of the Next 50 initiative, a campaign of theirs. And we began in 2018, and everything we do is rooted on educating people about ageism through advocacy and lots of innovative and creative efforts that we have developed in these last 4 to 5 years. And part of this, what you're seeing today, will be about what ageism looks like in healthcare. But in addition to that, we also have what ageism looks like in workplaces and intergenerational conversations about ageism. We have a toolkit that you can download for free from our website. We also have an initiative that's focused on age-positive birthday cards as well. So we tackle the issue of ageism from different angles and ways, so that with the hope of reaching everyone, because ageism is something that's impacting all of us, and we may not realize it until it happens. And then when it does, what we have and all of the work that we've created in these materials can help you be better prepared for what it may look like and how you can respond and what you can do to help us ultimately end it. So I'll get started into the slides here for you all. So why should we address ageism? Well, from what we do in our work, it's that it's everywhere. It's all throughout our society. It's not just in healthcare. It's in all sectors of work. It's in the public. It's on television, in movies, ads, campaigns that you see, all kinds of, especially media and advertisements. So because it's everywhere, it's something that's become very normalized. And because it's normalized, we don't necessarily recognize it or actually really understand how harmful it is to us all as we're aging. So we think it's really important, and I'm hoping that today what I share with you all will inspire you to want to learn more. And through our website, you can access all kinds of free resources that we have developed over time, and those are for all of you to share with your networks and your affiliates. So the definition that we use for ageism in our work comes from the World Health Organization. And the way that they define ageism is that it's the prejudice, meaning how we feel, stereotyping, how we think, what our thoughts are, or our beliefs, and discrimination, meaning showing up in how we act, all about age. So it's not just solely that it's directed toward older adults. Ageism is also experienced by younger people as well. So everything that revolves around how you think and feel and act, and the things that you believe about your age or the age of other people, it may be ageist, right? And it can show up in different ways. So I'll share different examples of what this can look like for all of us in society, personally and professionally. So I will go more into that. But this graphic that you're seeing comes from the World Health Organization. And back in 2021, they launched an international campaign called the Global Campaign to Combat Ageism. And it's specifically about how ageism is showing up all around the world. It's not just a problem in the United States. And it's something that we can all actually do different things to get involved in helping to reduce it and ultimately end it. So how prevalent is ageism? Well, as I mentioned before, it really is everywhere. And these are two statistics from the US that 93% of people experience ageism in their daily lives. So it's that dominant. And 93% see age discrimination in the workplace. So it's in our lives, in everything. And as the example before, I mentioned birthday cards, like just go to any drugstore or grocery store and look at the birthday cards and notice how many of them are negative about aging, right? And just making fun of it, making us feel bad about it, including even birthday cards that are, when you turn age 30 and saying that is considered, quote, old and something that we don't want to experience, right? So these messages are having an impact on how we think and what we believe. And the costs of ageism in healthcare specifically found research from Dr. Becca Levy at the Yale School of Public Health. She and her team are leading researchers on ageism. They found that the ageism specifically is costing $63 billion annually to healthcare. That's an incredibly large amount of money. And so just imagine if we ended ageism, the savings that would come out of that, right, for healthcare. And then in the workplace, age discrimination in workplaces is costing the economy $850 billion annually. So that as well, right, in the workplace, if we had no more ageism in workplaces, that would also save our economy money. And we also know that there is less funding in general for older adult programs and services. And these are all reflections of ageism, and less support for age-inclusive policies. So all of these things represent how ageism shows up in all these different ways, and it's something that we can do something about. So it's really important for us to understand how society thinks of aging. So not just us as individuals, but society as a collective, how we view getting older and what we think about age. And some examples of what this shows up like for us in this society we live in is, first of all, individualism, right? So the United States has, been created to be a very individualistic-minded society. So when we think about the dominant pattern of thinking, that how we do as we age being solely based on our good or bad choices that we've made along the way across our lifespans, right? When you apply that individualistic thinking to an individual on the choices that they made. So there may be we do see this public rationale that whether someone ages well is a consequence of their personal choices, their financial choices, their lifestyles, and their health choices. However, the most important thing here is that when we have that perspective of individualism, it obscures the social determinants and contextual factors that influence outcomes. So, for example, like whether or not someone has access to healthy food, to education, to healthcare, their caregiving responsibilities, access to employment, and just all the other systemic barriers that people may have experienced across their lives all have influence on how they're experiencing aging and what older age will look like for them. So that's an important part of us understanding how society views aging or what we're being influenced by in society. Then we have ideal versus perceived. So from this perspective, it's a conflict. Like this is a cognitive dissonance that we experience as individuals living in an individualistic society. So on one side, we have this perspective of aging that's about wisdom and independence and being active and possibly even earned leisure in retirement. Then conversely, we have this other image of older age being deterioration and dependency and decline. So when we think about these two opposite perspectives or beliefs about age, they're both rooted in individualism, and they also are rooted in just individual choices, right? So how do we reconcile having these two opposing beliefs? So there's another part of what is attributing to ageism in our society. And then lastly, we have this us versus them. The public's negative view that older people are a separate group apart from, quote, the rest of us, right? Like older people are this other separate group from everybody else. Compartmentalizing and marginalizing older people just simply makes it easier to justify not supporting policy initiatives for older people or older adult programs. When we look at resources as being finite and thinking in this mindset of providing social supports for people as they age, then it's presuming that we're taking resources away from everyone else. So it's that us versus them mentality. Another example would be millennials versus boomers and that languaging of generations where you're pitting a generation against another generation, when in fact, all of us are aging. We all share that experience. It's universal. So we should all see this as that we're all in it together, right? And then the other us versus them kind of language that we see, especially in the media, is messages about staying young, fighting aging, and those kinds of messages to us actually reinforce us, the separateness of us and the division of us as being an othering type of group. So all of these contribute to how we are influenced from these kind of social constructs, right, within society, and they're harming us, and that's not okay with us changing the narrative. So we want to do something about that. And so these are some examples of what ageism can feel like. And I do a lot of workshops with people of all ages and what ageism looks like in health and how it makes us feel. And this is some feedback that I've had from people. So it makes people feel invisible, depressed, disrespected, devalued, marginalized, and overlooked. And no one wants to feel like this, right? But because we live in an ageist society, at some point in time, you may experience feeling any or all of these, right? And that's something we can actually prevent this. We can do something about it. And these are also some feedback I've received in different workshops I've done on what ageism can sound like. So you may hear people say these or see this shared in society. So when we think of physical health, like this pain is simply because of my age. So when we hear that, it's saying that simply because I'm, say, whatever, like I'm 58. So I'm 58 and I have this pain because I'm 58. I don't have the pain because I'm 58. I mean, we can have pain at any age, right? So we have to look more deeply into what is actually going on and ask more questions, right? Mental health, we see this a lot in the media. All older people are experiencing depression, or an assumption being made that all older people are depressed. And that is not accurate. And we know that if someone is older and they're experiencing depression, that we need to ask some more questions because it isn't considered a normal part of aging. And then learning, I'm too old to learn how to use new technology. That's just not accurate. We can all learn at every age. The brain plasticity is lifelong, and we all have the ability to continue to learn new things. And then behaviors, thinking that I'm too old to change my habits now. It's never too old to change, and we all have the ability to do so. We just need maybe some encouragement from the people around us. So here are some examples of what ageism actually can do to us in our lifespans as we're aging, as we're growing and getting older. So what is known, much of this research comes from Dr. Becca Livy at the Yale School of Public Health, as I mentioned before, but she has found in her research that ageism actually accelerates cognitive decline. It's associated with increased depression, stress, and anxiety. And research has also found that exposure to ageism across time, across the lifespan, actually will increase cortisol levels and increases inflammation. And it's also known that 1/3 of therapists treating older adults have less than 1/3 of therapists treating older adults have had training in psychology of aging. So a lot of people have not actually been trained in the psychology of aging or in the physical health of aging, and we just need to be aware of that. And we would love to see improvements in that arena of just getting people better educated on older adults' health. Some negative impacts that it has on economic security. A study that was published by the Urban Institute, they looked at 20,000 people in their 50s with stable employment and had been working for at least 5 years. 56% of them were either laid off or pushed out of their jobs. And out of that group of people, only 10% of them ever recouped financially, which is devastating. And that's also a reflection of age discrimination in the workplace. It's very difficult for older people to find jobs in older age because of ageism. And that's a really important issue for all of us to be aware of, because many people need to work, and we just have to be doing better in that area of reducing age discrimination in workplaces. And it's also known that in the workplace or within work, as women get older, it's even more challenging, and even more challenging for women of color. And then speaking of memory, research also from Dr. Levy, she found in her work that when we have positive beliefs about age and aging, it actually can protect us against developing dementia. And in the research, they found that people with positive age beliefs at baseline were significantly less likely to develop dementia. This included people that had the risk factor for dementia. And what they found was those people that had the positive beliefs were almost 50% less likely to develop dementia than the people that had negative beliefs about age. So that's really significant, right? And then another interesting fact that they found at Yale was that what we believe about age can actually shorten our lifespans by up to 7.5 years. So when we have these negative beliefs about aging, it can actually shorten our lives. So all of these things really matter. And so knowing how society portrays aging, the messages that we're receiving that are inaccurate, we need to dig deeper, ask more questions, and bring forward all the different ways that aging can look for all of us. It's also been found through research that ageism is a risk factor for elder abuse. And one of the leading contributors to this is isolation. So we always want to make sure that people are not isolated because of the escalation of the risks that this can involve. And when we think about ageism, and older adults being viewed as less worthy and invisible, that can contribute to elder abuse. Older adults are also less likely to report abuse, so we may not even know that something's happening, right? And abuse can look all different ways. It can be mental, emotional, physical, it could be financial. And we also know there's underfunding for services and programs. So all of these things can put older people at more risk in general, but then that can also exacerbate things and ultimately possibly lead to elder abuse. So it's important for us to be aware of the correlation between ageism and elder abuse. And there's institutional ageism. What this is about is the systemic ageism that exists in society, in all the systems and structures that exist that we have in our country, right? So workplace age discrimination. When we think about that, we know that 2/3 of people over 65 intend to continue working, but age discrimination may get in the way because laws about age discrimination are pretty weak. We know that job applications often include identifiers like high school graduation dates, and then they're being pushed out and not even considered for job opportunities. And we also know that in our society, different employers also have mandatory retirement regulations. So there are many things that we can do about helping to change that. And just this year, Changing the Narrative, or Janine Vanderberg, who founded Changing the Narrative, was part of an initiative to put forward a bill that was to remove age identifiers from job applications, and that will go into effect next year. But that's one step for Colorado in the right direction, that we don't need to know someone's age on a job application. So it's just one way of creating discrimination that doesn't need to be there. So Medicare exclusions, what this looks like is just when we think of basic Medicare, not including preventative care for vision, hearing, and dental, right? Like these are really basic needs. Our vision, hearing, and dental are all things that we need to have in good shape and good condition in order to age well. If we don't have access to preventative care of those basic needs, then it's setting people up as they're aging for more risks for health complications or health issues that could lead to even more expensive healthcare problems, right? So Medicare should be redesigned so that everyone has access to all the basic preventative care that they need. And then another example of institutional ageism showed up during the pandemic. When it first came out and was in the news, it was being labeled as a disease that was impacting only older people, and it was not taken very seriously. And then I'm sure you're all very aware of how it impacted nursing homes and not getting access to personal protective equipment. All of those things, how that all played out, was such a representation of ageism. And it's what actually prompted us to create our age-friendly healthcare campaign at Changing the Narrative, because we realized how prevalent it was, how serious it was, and how many people were suffering because of it. So we just wanted to bring attention to this issue. And then interpersonal ageism, this is our interactions with each other. So this can be just within your family, your friends, it can be in the workplace, just talking to other people of different ages. And an example of that can be elder speak. And elder speak is speaking to an older person as though they're a child. And it may include like speaking in a higher pitched tone or using simple language or speaking to them as though they're incapable of making decisions. And what has been found in research is that elder speak actually causes people to have anxiety and depression and withdrawal. So we don't want to use the elder speak, even though oftentimes it's meant to be thoughtful with a good intention. We have to speak to people respectfully, right, and include them in, more as peers. And these are just a couple of quotes of examples that I've had from people in my workshops of where they've heard from like a health professional. So of course your knee hurts, you're getting older, right? And that's not very helpful to hear something like that. Or in the workplace, George, he's too old to learn that new software, making an assumption that someone, because of their age, isn't able to learn something new. So these are examples of how it can show up in our dynamics with each other. Internalized ageism, this is that self-talk that we have where we might be thinking like, I'm having a senior moment, or I'm too old to learn that. These can happen to all of us. All of us have elements and levels and just different degrees of how ageism shows up for us within our own self-talk. And at Changing the Narrative, we're working on some new resources specifically about internalized ageism, because we feel that if we can help people understand what it looks like within themselves, that is one step in the right direction to helping us ultimately end it for society. But these are just a couple of examples of how it can show up just in our own minds. And what we know from research is that when we have positive beliefs about aging, which we can do, even though society pushes against us, we can find positive perspectives. It can increase our lifespans by up to 7.5 years. It improves our health, gives us a greater ability to recover from illness and injuries. It reduces our likelihood of developing dementia and improves our memory and can even reverse cognitive decline. So there's many, many reasons why we want to have positive beliefs about aging, despite living in an ageist society. And through the United Nations and the World Health Organization and their research, they found that the effective strategies for combating ageism are through education, connecting generations, and influencing law and policy. So an example of education can be, besides like what we're doing here today at this event, is one of the things that we have on our website at Changing the Narrative is you can host a book club. This could be a great team building effort, or it could be something you do personally. But this is a picture of the book by Dr. Becca Levy, and this book came out last year, but it is an incredible book. I love everything about her book, and it just really will help you get productive and constructive conversations going about what ageism looks like and how it shows up. And so on our website, we have a toolkit you can download to create your own book club. So that's a really great way to start reducing ageist beliefs. Then intergenerational conversations. I mentioned it earlier, but we have a toolkit on our website for this specifically, where you can bring together people of all ages, another team building opportunity, or something you can do with your friends. But download our toolkit, and then within it, there are all different categories of questions, and you can customize them as you'd like to, but it's all different topics, but it's getting people together of all different ages, which literally automatically reduces people's ageist beliefs when you have these constructive conversations with deliberate questions addressing age and ageism. And then to support policy solutions. So thinking about what you're seeing in your work or just out there in society. Age discrimination laws, if you're seeing those, like, speak up. Maybe you can write to your legislators. Finding ways to upskill older workers, including them in the workforce and within healthcare. I know there's lots of things happening. There's something going on right now with Medicare, and we have information about that on Changing the Narrative. If anybody's interested in learning more, you can contact me and I can share with you what's going on federally. And then our stories about aging, how we talk about it, the things that we're hearing from other people or just within the media, the language that we use and the messages, all of these things are really important. So I'm going to share some of what we have found and learned from the Frameworks Institute in research they did specifically about ageism. So what they have found is that in talking about this demographic shift, right, we want to avoid what we often hear in the media as a silver tsunami or a gray wave. We know that we're expanding our older adult population and the population of younger people is declining, but we don't want to define that in some catastrophic, devastating thing that feels hopeless as though we can do nothing about it, right? So instead, we want to use language like people are living longer, birth rates are declining, and then this finite resources are zero sum, right? When we think about, oh, we can't provide for older adults because then we're taking away from children, just doing that is just not helpful to anybody, and it's not realistic to look at it that way. So we want to think about using our ingenuity and re-envision what is possible, what hasn't been done yet, maybe create new policies and programs that are addressing the changes that we're having right now. This is a new experiencing, it's new, this is new, right? This older adult population for all of us, we have to manage it in a different way than we've ever done before. And then just talking about ageism in general, when you talk about it in your work or personally, always include the definition, what ageism is, which is the stereotyping, prejudice, and discrimination directed toward people based on age. And then when we compare ageism to other isms, we don't do that. Instead, ageism is a matter of justice, and we always want to frame it around that it is about justice and what is equitable for all people as we're aging. And then talking about aging and older adults, in the work that they did at Frameworks Institute, they found that from their research that the terms elderly, senior citizens, or even when we use the terms like our seniors, those are demeaning to people. It's actually not helpful. So instead use the term older adults or descriptive language. So if you're talking about a group like, say, from 60 to 70, then say you're talking about older adults living in an urban setting from 60 to 70, or just be more specific in what it is that you're explaining. And it takes more work, but it's really important, right? Because our language influences policy decisions. Then the us versus them, especially that millennial versus boomer kind of languaging, we want to instead use the us and we. All of us are aging. This is something we're all experiencing. How can we help each other? And then the anti-aging, which is really dominant in the beauty industry, and then battling or fighting aging, that kind of language doesn't help any of us. So instead, acknowledge that aging is a normal and dynamic process. We are all experiencing it regardless, even if we don't live to an older age, right? We're all aging every day, and we're impacted by ageism. And explaining ageism, again, just the stereotyping, discrimination, also include the assumptions that are made and the stereotypes, like when we assume that all older people are depressed, right? That's a generalization. It isn't accurate. It's just something that we need to ask more questions about, find out the truth. And then an example you can also use is workplace age discrimination, which is really common. Another one is just to ask people to go to the grocery store and look at the birthday cards and notice how many of them are ageist, and that we don't have enough age positive birthday cards out there, right? That's another great example of what it looks like. And then implicit bias. This is kind of at the root of why it even exists. These stereotypes and assumptions that we make about age and aging and older age are unconscious, and they begin early, like around age 3 or 4. We actually are influenced by the stories that are read to us if we're as children, cartoons that we see where aged older people are portrayed in a negative way. And even the older adults in our lives, as when we're children, can influence these beliefs that start to form at such a young age. And because they formed when we were so young, they become unconscious within us. And then that's how we have that internalized ageist perspective sometimes. So this is for all of you, it's your opportunity to lead in this effort. So I would love, in small ways or big ways, if whatever resonates with you, I would love to see you take some of this forward in your work. So start thinking about your attitudes. Like, what do we believe? What do you see out there? What do you believe about your own self with your aging? What do you believe about older adults? And start to question those things. Where do you think it comes from? Why do you believe the things that you believe? Your behaviors. How can we each be role models in addressing ageism? What can we do better? How can we change how we speak about aging, how we interact with each other about aging and age in general? And then our communications. How can we shift our own communication so that we're reframing aging as something that's inclusive and empowering, because we're all experiencing this, and just encourage each other within our networks also to do the same. So hopefully this will resonate with you all. And then within the healthcare context, I have longer presentations on healthcare, and this is one of the things that I think is really important, and maybe all of you already have this in your organizations, but person-centered healthcare is so important. And for those that don't know, care that's respectful of patient and client preferences, right? Needs and values are being discussed in appointments, and ensuring that those values are guiding the clinical decisions being made, and having patients be included in the decision-making process, and really focusing on what matters most to the patients and clients and directing it in those ways, and just finding more about their history. Cultural context is really important too. We don't know a person's history until we start asking questions, and those things really can guide the direction of decisions being made. So I think this is just something that all people need to know, and I'd love to see this be just normal in every aspect of healthcare. So this is just how you can reach out to us. On the first line, that would be just reaching out to Changing the Narrative's email. The second one is to find our website. It's changingthenarrativeco.org. And if you have questions for me, if you want, and if I have just get more information about my work, I'm at the bottom there, Kris at changingthenarrativeco.org. But I would be happy to hear from any of you if you have questions about ageism. Reach out anytime and take advantage of all the free resources that we have on our website. We have so much to share with everybody. So I appreciate your time. Thank you so much.
Thank you very much, Kris. Really appreciate having actual ideas of what to do with this and how to take this back to organizations.